Wonderful. All right. So thank you guys for coming out tonight, even though the daylight is still there for a couple more hours. I do this introduction to really teach you what's health, what does it really mean, how do we maintain it, and what exactly are we doing to our spines, and why is it so important to get the upper cervical spine corrected. So if you have any questions, feel free to write them down on a piece of paper. The feedback sheet helps me make a better presentation, and I'll do the best I can to answer those questions if you have any at the end. So before I go into this, I want to explain a little bit more about me and who I am. So on the upper left side, there's me and my grandma. She's one of my eldest patients. She's 95 years old. She gets this correction done, and it's really helped her out mentally, physically. She's able to enjoy her life much more now. She started care when she was 91. So better late than never, but there is permanent damage that we can't reverse. But if I can help her out, having a much better quality of life these last few years, wonderful. You met Teresa Stokes, Dr. Stokes. There's me in the middle when my beard was much longer. She's my chiropractor, so I get corrected or really checked at least once a week, if not 2 times a month at the minimum. So I stay with and without pain and also function better too. On the right side are my 2 little fluffy children. They usually come in on Fridays. I went to Palm Harbor University High School, so I'm a local. Went to FSU for college in Tallahassee, and then Palmer College of Chiropractic in Daytona Beach. I write a health blog for fun at drberner.com, so feel free to check that out and peruse that. So, real quick, if you guys have an Instagram, follow them. If you don't, you should create one and still follow them. They're awesome, they're very friendly. If you like dogs, they usually come in here on Fridays, okay? So, 2 different people here, okay? The man on the left, he's probably in his 60s or 70s. You've seen him before. He's at the YMCA. He's running around a lot. Not a lot of health problems, very active, okay? The guy on the right, younger, in his 20s or 30s, complains of headaches and pain and migraines a lot, many different types of secondary problems. What's the difference besides their age? The guy on the left, somewhere in his life, somebody gave him quality health information so he can make quality health choices. The guy on the right has yet to receive that yet. Tonight, I'm going to give that information to you. What it does, it can have the effect to change your health for the rest of your life, change your family's health, and change the health of every single person that you'll meet from this day forward. So it's a pretty bold statement. I'll ask that again at the end. I might go against some more of the modern medicine beliefs, but everything is based on research and facts. Okay? So, what is health? Well, the first 4 letters are heal, and that's what health is to heal. Here's the definition. So, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Notice how nowhere on there does it state no symptoms. The first symptom of having a heart attack is having a heart attack. You don't feel the heart wall starts to plaque. It was not the hot dog that caused the man's heart attack. It was years and years of damage. He didn't really feel until it was too late. So we don't want to judge our health on how we're feeling. When we want to judge it on how we're functioning, okay? So the first adjustment was actually way back in the day, 5th century BC, roughly. Bone setters were highly sought after in the Greek time. The first chiropractic adjustment was 1895 to help out with someone's hearing loss, not for headaches or back pain. He had a lump in his back, on his upper neck, got that corrected, his hearing came back. So somewhere along the line, it has transformed into what we have nowadays, but way back in the day, that is what was highly sought after were these bone setters. Chiropractic is Greek for practices by hand. That's what it stands for. So what is foundational correction? What are we actually doing? To understand that, we have to understand what is traditional chiropractic. So traditional chiropractic is this. Over 70,000 of these guys and girls around the entire country, and they help out a lot of people. People that want some natural short-term pain relief, because that's what it usually is we're going to improve range of motion, decrease muscle spasms and pain. At the end of the day, it's usually short-lived. Because what are they doing? They're tremendous at what they do, which is going to be pain management. They're great at patching drywall in the house that has a weak foundation. The drywall keeps cracking, the windows are kind of not closing properly, the roof shingles are falling off, the floorboards are loose. Why does that all keep happening over and over and over again? Would you do that to your house, or would you call the inspector over, figure out what the cause is, the primary cause, and fix the house's weak foundation? So to back up further, what really got me into chiropractic? I don't have any miracle story growing up. I didn't have scoliosis. I dealt with some neck pain and headaches from playing football in high school, but it was my dad that got me into this technique, or really got me into chiropractic. So in Palmyra High School, we could shadow people our last year there. I was the first one at the school to shadow a chiropractor. Now when I went to college, I did want to help people, not really sure what I wanted to do, but I shadowed some more chiropractors, and I shadowed one in Clearwater that did a pretty interesting technique. She took this instrument, she clicked behind her patient's earlobes, and her pain was gone. Not really too sure what she was doing, but I came home from Christmas break. My dad always dealt with low back pain. He did 20 years in the Air Force, but it was to the point that he was using a cane to walk. His low back was so painful. A 52-year-old to using a cane to walk, it just was just horrible, because he said his low back was so painful. So I told my dad, go see this chiropractor. She does things differently. I think she can really help you out. So my dad supports me, which is awesome. He goes in there, gets the x-rays taken. She shows him, I think I found your problem. The top of your spine is so rotated, just like with this slinky, it can cause your low back pain because your foundation is shifted and your low back is compensating from that shift. First adjustment, first one, he ditched the cane. He stood up and he never used a cane ever again. He walked out of there, he came home. I'm like, Dad, so where's the cane? I got rid of it, threw it out. So that told me something is interesting here, something special. I need to learn this. I didn't learn this in regular chiropractic schooling. I had to travel and learn this technique and take extra courses, spend more money, but I wanted to do something to help people and to really fix the primary condition and not just treat symptoms over and over again. So this is our foundation, the atlas bone. Where does it come from? Back to the Greeks again. The atlas, Titan holding up the globe. Our atlas is named that because it's holding up our globe, the brain, which is really important, right? So on the side, there's these two little holes. That's the blood supply to the brain, one of them. So if it rotates, it can obstruct blood flow to and from the brain, decrease oxygen, and cause different types of problems. These two surfaces here are what the head sits on. So we have basically a stick of gum with a bowling ball on top of it. Every single nerve in your body flows right through this area. Top of the spine, there's a brain stem, then there's the atlas bone, and then all the nerves in our body that control every single function. So there's the occiput, or the base of the head, atlas, and axis. So these are the only two segments of the spine that have a specific name, C1, C2. Axis looks just like this, because the atlas bone is spinning on the axis. 80% of the range of motion of our neck is done by these two small neck bones at the very top of the neck. They move the most, so they're probably going to shift the most. And when that happens, it throws off the bowling ball head. We have a foundational shift, and then we have all these compensations. The shoulder tightens up. The low back starts tightening on one side or both sides. We can even get knee pain because we're putting more weight on one side versus the other, and then over time, it can lead to these different types of problems. The Leaning Tower of Pisa, just to kind of paint the picture of what this can do for the rest of the body if the top is shifted. So we can all agree about normal health values when it comes to our blood pressure, 120/80, right? Heart rate, body temperature that we're getting checked a lot, eyesight, ear function. What controls all that is the nerves. What protects the nerves is the spine. We need to have our spine nice and straight front to back, and 3 curves on the side that are in line with the ear, shoulder, hip, knee, and ankle. Everyone gets their tires realigned. Every 6 months you're supposed to. If not, you start self-adjusting, right? You start moving the steering wheel over, just like how some of us self-adjust our own necks. Your body's telling you something is shifted. So you keep doing that, it wears down on your tires, costs you more money, suspension problems. So you take your car into the shop and they just start cracking and popping, right? No. They put it up on a lift. I'm not a car mechanic, but they basically put it up on a lift. They use a software to figure out how it's shifted, and then they realign this back to normal. That's what we're doing. We're looking at the foundation at the very top of the spine, and we're seeing how this is misaligned, and we correct it. So we're not just adjusting one bone, we're using it as a lever to readjust the rest of the spine. There's the 12-pound bowling ball and the 2-ounce pack of gum that's right underneath it. You guys remember him, right? Fell off his horse, fractured atlas and axis. Hopefully we can have habits that are not like this. So this degree, that bend of the neck, can add up to 60 pounds of pressure on top of the spine. So I'm not suggesting to hold your phone up like it's Simba, on Lion King. Hold it by your sternum and use your eyes and look down, mid-chest. Don't lay in bed with your neck like this. Hold your phone up, or maybe not use your phone in bed. Every 1 inch that your ear is over your shoulder is adding 10 extra pounds of pressure on top of your spine. So most of us don't walk around with a bowling ball head. Usually it's 2, 3, I've seen as much as 5 pounds of abnormal leverage because the neck is not in the right position. The ugly part is this dowager's hump. So when the head weight theoretically increases, it's like a seesaw. All that extra head weight, so the body puts more tissue deposit on the upper back. And we get that nasty dowager's hump that starts to form, and I'm seeing this more in the younger people, okay? We call this anterior head syndrome. So it's a syndrome because it causes many different types of problems, symptoms, or what we call secondary conditions. So head goes forward, arthritis builds up on the front part of the neck. Why? The body puts extra calcium on areas to kind of protect it, to make it harder and more stiff, but it will decrease the joint space, decrease the disc height, compress nerves, and lead to problems. The dowager's hump we just talked about. But look at this laundry list of issues here. One of them is carpal tunnel syndrome. So 75% of carpal tunnel actually comes from the neck. When we're at the computer, we don't type like this, right? If you have a stand-up desk, yes, we lean forward. And right there, we're making the head heavier, and we're causing issues, and that can stem from the neck going down into the wrist and lead to this type of problem. So what they do is they do a $3,000 to $5,000 operation where they widen up the carpal tunnel. There's 8 tendons that run through there, and it does help out. But what do? They just treat the symptom. They're not treating the cause of that symptom. It can help. You can wear a splint at night. Some people sleep like this. But how about we fix the cause of the issue and get your head on to the normal position? MDs are talking about it, but also the Mayo Clinic too. Forward head posture leads to long-term muscle strain, disc herniations, arthritis, and pinched nerves. What's the most important block of this arch?
The top.
The top. Exactly. Smart. Not the bottom. The smallest little block. When we take away that keystone to the foundation, the whole thing collapses. Just like our atlas bone. So it's crazy how we're made. With the blood vessel, one of them to the brain, does 4 90-degree turns through that hole of our atlas bone. When it shifts, it can increase the systolic blood pressure, the top number. They did a research study in 2007, Chicago University, and they compared getting the atlas corrected specifically versus not just 1 drug, but 2 drug therapy combination to lower down blood pressure to normal. Guess what won? The atlas corrections. So if there's a shift, it can partially obstruct the blood flow. The heart is going to counteract that because it wants to maintain balance and increase the pressure. When we fix the cause of the issue, obviously, I'm not saying atlas is the reason why you have high blood pressure, but it could be diet, stress, lack of exercise. But it would make sense that if the blood flow is slightly obstructed, the heart will counteract that and increase the pressure. We get headaches and migraines. Atlas displacement complex. So when the atlas displaces, it causes a complex. I already talked about high blood pressure, but ear pain. So these nerves, they branch out and they go to the face and also the ear. So if you hear a whooshing noise, maybe there's blocked blood flow or any kind of tinnitus. Could be the nerves are not functioning properly, go into that ear. Something's probably shifted, but also TMJ problems, jaw issues. People have chronic clicking and popping. If there's no structural problems, it might be, possibly, the nerves going to that area are obstructed, they're not happy, and they cause cramping. It's hard to open up the mouth all the way. It's hard to chew food, possibly because there's that foundational shift. So you guys are sitting up nice and straight, which is great. If you can roll your neck around in a circle. You start hearing Rice Krispie treats in your neck. That's called crepitus, which is it's not in the right position, so the biomechanics of the neck are off, and the tendons kind of snap over the bony structure. So when we get that in the right position, we can decrease the sound of that. And then when you get home tonight, look on the bottom of your tread of your shoes. You might notice one of them is worn down more than the other. For example, if you're right foot dominant, you might notice the outside wear on the right heel area is worn down more than the left. So what happens? When we have that foundational shift, we get degenerative joint disease, decreased blood flow through the brain, decreased spinal fluid flow, and then brainstem obstructions. we want to have this nice curve in our neck. Why? Curves are very strong. That's why bridges are curved. We want to make sure that bowling ball head is supported. So you take your hand like this, it's nice and shock absorbent. When we lose the curve, it takes time to lose it, but you get into car accidents, that whiplash effect can drastically change the curve on the bad side. So it can go forward, and that stretch you feel in the fingers, that's happening to the neck, the upper back, mid, and low back as well too. Uncorrected, the body starts increasing the calcification, decreasing of the joint space, and leading them in different types of problems. These are two different patients here. Patient on the right, 63 years old. Patient on the left is 53. So age is just a number, exactly. Because how can the patient that's 10 years older has a much healthier looking spine? Notice how there's plenty of disc spacing here, plenty of spacing. A little sharp right there, but for a 63-year-old, that looks awesome. On the left side, what do we see? Horrible bone spur right here. Decreased joint spacing. This one's kind of collapsing. These want to fuse together. What did he present with? He said it felt like he was walking around in space. Fogginess, shooting arm pain, and headaches and migraines. Mainly because his neck is actually going slightly forward. This patient took care of himself. He went to the chiropractor. His neck is nice and curvy. That's what we want to see. So this is an MRI of the atlas bone. So they're like this, and it's shooting up this way. The red line is the misalignment, before and after. At the very top, you can see the patient's teeth. What's that yellow arrow pointing at? What the yellow arrow is pointing at is a jugular vein. So not only are we getting blood flow to the brain, so systolic blood pressure, but diastolic too. So blood flow leaving the brain. Everything has to circulate to clean out waste product, dead cells, all that, and we got to make sure everything is flowing correctly for proper nutrients. When that obstructs, we can increase the blood pressure at that site. You guys seen Young Frankenstein, right? I hope.
Yep.
Okay, awesome.
Classic.
Good.
Find a way to equalize the imbalance in a cerebral spinal.
So spinal fluid. He's talking about creating the monster, the Frankenstein monster, I should say. So spinal fluid. What is it? Spinal fluid, cerebrospinal fluid, or CSF, is a watery-like substance that cushions the brain tissue. So it's in the brain area right here, and it's like a plumbing supply. It cleans out dead cells, waste product, toxins. Probably got to rerun the cycle, or they just smell and you got to throw them away. What if you did that for 40 or 50 years? You just left your clothes in the washing machine. Things will probably start growing. Maybe the t-shirts and the clothing shrink in size. This is what's happening to our spine. At the upper cervical spine, that atlas bone is basically a choking point for the spinal fluid. The white is the spinal fluid, this black is the cord, this is the spinal column. It's a canal that it goes through. When this shifts, it can kind of pinch that off, and then if you notice, the sun's kind of coming in now, but at the top of that area, there's the brain tissue. It's kind of thicker and wider than the other spots, if you can see that. So I'm pointing right to here. You can probably see that. It's a little bit puffier. That's the trapped spinal fluid. It's pooling on that brain tissue. So the latest research, this is from 2015, is that when that upper cervical spine shifts, it can lead to, of course, pain, headaches, and migraines, but it can either cause or make worse Alzheimer's, Parkinson's, dementia, all these brain issues that we're dealing with later on in life. They are saying that Alzheimer's is type 3 diabetes because sugars and carbs are in everything, but it could be improper spinal fluid flow, because now we're dealing weighted MRI, so they're seated or standing, and they can actually see the spinal fluid flow to and from the brain much easier if it is there at all. So this lack of spinal fluid flow, it stays trapped in the brain tissue, and this is what it does to the brain. Healthy brain on the left, Alzheimer's brain on the right. Notice how it's shrinking. So this is not an age-related problem. This is why a lot of football players are getting this early on in life, because of the trauma that they do to their necks, the spinal fluid stays trapped and it decreases the space of that area of the brain. Left is the x-ray, the right is the MRI. What we're noticing is that the green is the normal curve, the red is this patient. This is the bony structure, bone spurs, arthritis, degenerative joint disease. All this can happen because the spine is not in the proper position, extra head weight on the front. On the right is the MRI. It's the soft tissue. It's pinching off this area. The spinal fluid is staying trapped at this spot, and then it pools at the brain tissue. So I'm going to play a quick video. This is a story about a football player by the name of Mcmahon. You might have heard of him before. He played quarterback for the Chicago Bears back in the 1980s. Great quarterback. They had a killer defense. So what did the opposing team do? They took out all their frustrations on him. Slammed him down on the ground, a lot of concussions, a lot of brain issues. He gets a similar correction done at a doctor in New York. He's going to explain his story.
There we go. This is what I do to try to keep my brain sharp during the day. I've got these puzzles, and it helps me to just try to remember things, you know, colors and where things go. I knew I was missing a couple pieces. You know, the doctor actually told me that this would actually be good for me to help keep my brain sharp and functioning, because at times it tends to wander.
Jim McMahon is 56 years old. He now spends most of his time in his Scottsdale, Arizona home, where the dry desert air best suits his long list of post-football aches and pains.
This is my daily routine. What am I doing? What am I looking for?
But what the climate can't combat are the symptoms associated with brain trauma McMahon suffered as a player.
Bad headaches, pressure on my skull. I couldn't see very well, couldn't talk very well. All I wanted to do was lay down, because my head was just constantly pounding. The pain had gotten so bad where if I had had a gun, I would have been here. And these two doctors from New York called me and said, "Hey, we think we can help you. We think we know what's going on." I said, "Let's do it."
Jim was diagnosed with early onset dementia. He had been complaining about a brain fog, as he described it, as well as he described it, a headache where he felt like ice picking on both sides of his brain.
While most concussion studies are focused on the brain, McMahon's team traces the effects of CTE directly to the upper spine, having found that neck misalignment can block the flow of spinal fluid and pool toxic proteins directly onto the brain.
Spinal fluid is white. That's the spinal cord. This is the spinal column. What you're seeing is a narrowing of the opening where the spinal fluid is supposed to come through.
Most times when you're having head problems, that's all they look at is the head. These guys are smart enough to at least look below the head at the neck and see if there was a problem somewhere. They found my problem. They're not going to be able to reverse the damage. Like I said, that stuff was sitting in there for 20 years. So how much it ate away at my brain, I don't know.
Using detailed images captured by the MRI scans, McMahon regularly receives targeted adjustments, clearing the blockage and restoring the flow of spinal fluid.
This instrument is going to generate a gentle mechanical tapping that is just lightly going to put those bones right back into normal position. Okay, I'm going to sit back up.
First time they did this procedure, within 2 minutes, it was like the toilet flush. I could feel this stuff actually leaving my brain. My eyes cleared up, my speech cleared up.
The left is before, the right is after. So you see how much there is there? See how there's less than here? Instead of all this white stuff being there, you're seeing more brain tissue than fluid. So it's already started to brain. Over the next several days, it's going to do for it.
What damage it's done is done. I can't reverse that. But what these guys do for me, they keep me from having these bad pains, having these suicidal thoughts, having me function fairly normally while I can't.
So I know you guys aren't football players, but I think this is the cause of a lot of their issues, and what they keep focusing on is making the helmet a stronger hammer. When they increase the padding for it, when they focus on making it safer, all they're doing is making it easier for them to hurt each other because they're going to use their heads more. This is a CTE brain. Left is normal, right is CTE, far left is Alzheimer's. I'm not saying they're the same thing, but the mechanism can be similar. The spinal fluid is not flowing properly because their necks are severely shifted. Their necks are so messed up, the spinal fluid stays trapped, and that's why when they're done with football, when they're in their 50s and 60s, that's where they start noticing these issues. So, what are your treatment options? I'd love to tell you that Atlas corrections can fix everything, but that's just not possible as there's many different things that our body can deal with. Top left would be physical therapy, so we don't do any forms of rehab, any torn ACL, any kind of shoulder rehab issues. I'm going to send you out for that. We'll co-manage together. We'll make sure your foundation is in the right position, and they're going to focus on their specialty, which is going to be physical therapy. Top right would be medication. There's a time and a place for it, but should you be taking a pain medicine for something that's chronic? If you're in a car accident and you need to bring the 9 or 10 out of 10 pain down to much more manageable 5 or 6, okay, sure. But long term, that's the same as putting a piece of black duct tape over your check engine light. No one does that. We take our car in to get fixed. They don't just guess, right? They use that diagnostic scanner, they plug it into your car, it spits out the codes of what's wrong with it. So, bottom left would be cortisone injections. Long-term use destroys the cartilage. And that's why a lot of us walk around with knee replacements and hip replacements because we keep getting these shots every single month sometimes or a few times a year. The bottom right, hopefully we prevent people from going to this stage, but spinal fusion surgery is just no good. It locks you in that bad position, the segments above and below work double time, and then they wear out next. Has a very high percentage of failure because the prognosis is really poor. So we want to keep people, our patients, off the operating table because we're going to fix the cause of the issue. We're not going to just keep patching drywall up over and over again. We want to fix it, not patch. So before and after, we want x-rays to show us what's going on. We don't want to leave it up to guesswork and, yes, you're feeling better, but we want to see it on the x-rays because that's going to show us, yes, this is a change that's more long-term versus something that's short-term. So I'm going to fly through a couple of these. So I'm going to talk about some case studies. These patients, they have all signed up on their stories, so I want to go over this first one. This is Mary, 22 years old, female. She always complained about headaches and migraines, just really poor. Just every single day she had some kind of headache or migraine problem. That's what she told us. But also painful menstrual cycles, and she just got married, but she couldn't get pregnant. So she goes to her primary care doc, and there's a lot of good doctors out there. They're really smart people. We just look at things differently. They look at this side of you. I don't see that. I don't see the hair. I don't see the nails. I don't see the wrinkles. I see this side. So we can work together. I'm not saying chiropractors are better than MDs and DOs. They have their specialty, diagnose, pathology, treat. We can also correct the foundation, but work together. She goes to her primary. He gives her a pain medicine for the migraine, something for the painful menstrual cycles. Didn't really do too much. Tried another one, and then another one, until he said, Mary, I think I found the cause of your issue. We're going to do a hysterectomy. We're going to take out the uterus because that may be the cause of it. So if the pills don't work, let's just cut it out, I guess is how some of them see it. So luckily, she came in. We had a consultation. I looked at her spine. It's going forward. The atlas is not in the right position. We need to fix this curve. Now, this did take some time to fix. After the first month, the migraine started going away. By the second and third month, the painful menstrual cycles stopped. So where does the cramping come from? It's actually the hip flexor, the psoas muscle mainly. So that's how we walk. Legs go up like this. It attaches into the hip, but it starts in the low back, super deep where your spine is. So when it cramps maybe on one side, it can tighten up in super deep. It's a very big muscle, and that can cause that. So if something is shifted already and is partially tightened, then when they have their monthly cycle, it can tighten that up more. Okay? At the end of the program, a month later, she called the office. She actually got pregnant. So, which is just awesome. I'm glad we can help her out. But all we're doing is we're getting her to experience normal. That's how we're supposed to live, is without these types of problems, without these secondary conditions. You've seen people like this before. This is John walking forward like this. Really bad anterior head syndrome. Chronically tired, always taking naps, but shooting arm pain, horrible quality of life, and we improve that, getting him closer back to that normal area. This is an 86-year-old male. This took 4 months. This is actually 4 months later. There is permanent damage. He chose to ignore the issue, kind of tough it out. Most guys are like that, but permanent damage. If we can stop this from getting worse, awesome. If we can reverse it, getting him closer to normal, that's even better. He came in here with chronic constipation, lower back pain, and neck pain, to just occasional neck and low back stiffness. But the constipation problem, back to function. 75% of the nerves that exit the spine are going to organs and tissues. This is how the body communicates. It's the automatic operating system. Just like our iPhones, When we're sleeping, what controls your lungs to breathe? The body does it by itself. What's controlling your heart to beat or digesting the food that you just ate? All by the nerves controlled by the brain. When we can correct the foundation, fix the primary condition, we're not just fixing headaches and migraines, the body's doing that. We're facilitating the healing of the body from the inside out. We're never giving the body a pill, nothing externally. We're correcting it, then internally the body can heal itself. This is a 9-year-old patient, was in a horrible car accident, complained of headaches every single day. And a 9-year-old and a 95-year-old. No one should be having headaches. Having a normal headache is like having a normal tumor. You shouldn't be having either. This took about 3 months. We fixed the curve going back to normal. No more problems. And they stay away. He periodically comes in to get checked and corrected when needed. I want to zoom in on this one. Before, after. Before, her head's moving, her neck's not. After, notice how it starts to really open up. These one to fuse together, horrible bone spurs, degenerative joint disease, all throughout the entire cervical spine. So I'm going to go to this one. This is Dr. Windsor. This is back in 1935. He's a pathologist. He looked at 200 cadavers. Every single cadaver he found was that organ supplied by pinched nerves reveal pathological changes. The more serious the pinched nerve, the more serious the organ damage. Now, I'm not saying your spine shifts and it causes heart attacks. It's one of the variables, though. Stress, diet, lack of exercise. But also, it would make sense that the nerves going to the heart, if they're obstructed, can decrease the function of that. Every single cadaver he found, dead body, was that they had these types of problems. So, every single patient has their own specific correction. We give them at-home exercises. Usually, I ask them how they're coming along at the re-exam, and if they have a flare-up, 90% of the time, if not more, it's because they're not doing the exercises. So we do them to correct the spine back to normal and to really support the corrections as well. We give our patients cervical pillows for their head, so they drop down in the middle. Back or side sleeping, we never want to stomach sleep. Why? Try standing in front of a wall and do this for 10 minutes. Might hurt. Now imagine that with your body weight, you're subconsciously, of course you're sleeping, so you're not going to feel it until the morning. You wake up with a stiff neck and back. It's very hard for us to stabilize these corrections if you're twisting your neck all night long. The body likes that because of the pressure. So sleeping on your side with that knee pillow on your back is fine. We just never want to sleep on that stomach. I'm going to talk about some supplements, then we'll start wrapping up. The most important supplement on the market, one that everyone should be taking, is not a multivitamin. Sometimes we just urinate them right out and just, money flushing down the toilet. That's why the urine is really bright colored. You're just peeing out all those B vitamins. Vitamin D is different. It's actually not even a vitamin, it's a prohormone, a steroid. We get it from the sunlight. We have to be direct sunlight with at least 75% of our skin exposed between the hours of 12 and 4 p.m. Why? It's when the UV index is at its highest. But we work though. We're inside nowadays. We're not hunting, or we're not gathering, and we're not fishing out in there. When we do go to the beach, which we have here in Florida, what's the first thing we do? We drop our stuff off, we spray on the sunblock, and that blocks the conversion. So next time you're at the beach, 20, 30 minutes if you can, and then go into the shade if you have to, but get that natural source of vitamin D. If not, grass-fed foods are great, or supplementation. Every single hospitalization of COVID-19 and death had low levels of vitamin D. I don't know why they're not talking about it, mainly because it's a very low-cost vitamin, and they make a lot of money with tests and so on. But if there's one thing that we need to be constantly taking every day and adequately having vitamin D levels high, is taking vitamin D. So, vitamin K. What is that? Vitamin K stands for coagulation. They use a K and not a C because it's German. They found out that K1 helped with blood clotting. So if you bruise easily, it could be a K1 deficiency. K2 is different. It's a newer supplement. It's a calcium transporter. So if you're not taking blood thinners, always talk to your doctor first, but 100% start taking vitamin D and K. They work together. They're fat soluble, so they help the absorption of each other. Calcium transporter means we're taking the calcium from the bad areas, the heart walls, the eyes, the joints, and we put it into the teeth and the bones, preventing cavities, making the bones stronger, but most importantly, taking care of our heart. The research out there is just stupid. It'll decrease the chance of stroke and heart attack by over 50%. So taking vitamin D3 and K2 is tremendous. Probiotics, unless you know the local farmer, organic, non-GMO, everything is conventionally farmed, sprayed with pesticides, everything is harvested over the same soil, nothing is dying and decomposing, putting their nutrients into our food, we have to take a probiotic. Why? First off, the probiotic are mainly in our large intestine, but guess what? They outnumber our cells 10 to 1. So we're not really human, we're really a walking colony of bacteria. There's research that's published that there is a link between a poor gut health and mental health. So someone in Utah that's chronically sad, depressed, tired, and they did some pills and a bunch of antibiotics, probably, destroy the gut flora, and they become more sick. They get sick more often than normal, but also their body's not digesting, absorbing key nutrients. So the bacteria are super important. A little fun fact, around us, on us, in us, and around the entire world, the microbes, the viruses, the bacteria, there's over 5 nonillion. So 5 nonillion is 5 of 30 zeros, meaning there's always going to be a scary virus. There's always going to be a bacteria. What we want to do is we want to optimize our health. We want to make sure that we have the natural body armor to defend against it, because you're going to get sick again. It's about the recovery process or not getting severely as sick. And that's what probiotics and vitamin D can do. E+ is the omega-3, it's a fish oil. Here in the state of Florida, there's no cold water fish. And almost everything here is farm raised. Nothing is wild caught. So salmon is dyed, so they sell it because it's pink. Salmon's not really pink. Most the fish that you buy at the supermarket is farm raised, meaning it's not a happy farm. They're not taking good care of the fish. They feed them just junk so they can maximize profits. Unless you eat wild-caught sardines and anchovies 2 to 3 times a week, no one really does, so we take an omega-3. It contains omega-3 fatty acid. That fatty acid is an essential fatty acid, meaning our body does not make it. It's needed for so many different kinds of processes, but it lines every single cell membrane. It's needed for optimal brain health, heart health, blood pressure control, triglycerides, joint inflammation, many different types of things. Someone has a disc herniation, disc injury, it'll lubricate up the nerve cells and speed up the conduction of it. It also helps the body function better. It's crucial we stay on fish oils unless you're getting wild-caught fish. E-Flame X. Now, to back up, for those that are vegan, you can get this source from algae as well too. The fish eat the algae, we eat the fish. Smaller fish, the better. So anchovies, sardines, mackerel, there's less chance of lead, mercury, other types of toxins out in the ocean. E-Flame X, this is a wonderful product. There's 3 key things in here. White willow bark, which is a natural form of aspirin, boswellia, and turmeric. Turmeric, there's some companies that sell it with black pepper because it helps out the absorption, but you need truckloads of it, so it's just a waste. So we don't include that in there. They all work together to decrease the inflammation and help out the body naturally by lowering down the pain. Just a really good product to stay on. Titanium, this is not a heavy metal. It helps to boost the immunity by having some key things in there, like astragalus, cat's claw, just a wonderful product to stay on. That's it. Last thing, if you can take it home, buy it tonight, is drinking apple cider vinegar. Tremendous. Dollar for dollar, probably the best thing to put into your body. What is it? It's acetic acid. It's an acid. It has a 2.5 pH. Our stomach acid is a 2. So when we have the acid reflux, the stomach acid regurgitates back up, can be caused by the food we eat or stress. It's really because the pH is off in the stomach. The valve does not close and it regurgitates. We get the stomach acid. It hurts. It burns. Heartburn. So if you went out to eat, you had a bunch of pasta or a really heavy meal, do a shot of this. Don't drink it by itself. Chase it with water because it does not taste good at all. Okay, but in there it has a thing called the mother, which is that brown filming like goopy stuff. Shake up the bottle. You need to get that inside of you. Take it at least 2 times a day, 2 tablespoons. There's research that came out about it's better than metformin and balancing out blood sugar. Just so many different types of things. Always stay on it. It can be used around the house as a cleaner. It helps control dandruff, smelly feet. It just balances out the pH of our floras. This is our goal. We want to get back to normal. We want to make sure that our spine is in the right position because that's how we function better. That's how we live optimally and have a better quality of life. We start getting rid of pain and headaches. We start feeling better. You're just feeling like a normal human. We can go through life without these different types of secondary conditions. The sooner the better because it takes time to heal. For some reason, it takes 9 months approximately to make a human. I don't know why it takes 9 months, but that's what it takes. 9 months to form a human, minimum 3 to 4 months to repair nerve tissue. We don't want to end up like this later on, like our brain decrease. We never want to ignore a foundational problem. Okay? If there is something going on, your body is telling you, it's giving you a warning, hey, here's a headache, here's some back pain, can we fix it? And a lot of people, it's their choice, they choose to ignore it or they choose to numb it. It's like a child, a small kid, who's very hungry and she's screaming at her mom. What does the mom do? She turns on Netflix, puts in earplugs, and ignores the kid. That's the Tylenol, that's the Advil, we're ignoring the issue. We're ignoring the problem. So get yourself corrected and fixed. To wrap up, I have one more patient to show you. He signed off on having his films taken. So he was in the military. He wore a pretty heavy machine gun, at least 60 pounds, climbing up mountains in his 20s, deformed his spine later on in life. So he walked around with a walker. This is him pushing up. He was at a 90-degree bend. When someone does this to their spine, it's very hard to get any long-term correction. Head's going forward, 4.5 inches. Everything is fused together at the front. There's not much that we can do but try our best to control the secondary conditions. So to finish up, everyone in here is a patient, which is great. But if you know anyone out there that is interested in fixing the cause of their issue, we offer consultations that are complimentary. We can kind of explain the process, see if we're a good fit. I do want to thank you, of course, for your time. So my girlfriend that was here earlier, Dr. Stokes, she thinks that I should compensate you financially for your time, for listening to me talk for about 45 minutes. I have something better. So Joanna's going to get some gift certificates, and I'm going to give them one of you, get each one, and that can be used for savings on a new patient exam or x-ray. Most of our patients that come in here refer at least one patient, many refer more. Why is that? There's a whole world of people out there. I have 2 hands, so if you can help me out, we're going to make our society, our community much healthier, and globally we can start having everyone live a much better quality of life, improving overall function. That's all that I have. If you guys have any questions, let me know. Filling out the feedback sheets really help me out. If there's any kind of health topic or presentation you want me to talk about, feel free to circle it. If you have anyone that you think that can benefit from this information, let me know. I know COVID's still going around, but I can do this talk on Zoom for your coworkers, or I can go to their office. I have done this talk before, so, or something similar and shorter. All right?
All right.
Awesome.
Thank you.
Thank you.
Thank you.